Welcome back. Oh my gosh. Okay, so this video I've been talking about and stressing about because it's like a lot. So I've decided to split it into two videos. I don't want to rush through it, and plus there's just so much. Like it's a good thing, I think. Like the fact that I can tell you all these experiences that I've had, but I'm gonna start from when I was a baby or like a child. And I'm just gonna work my way through everything because I think it's worth knowing as a child what I was doing for trying to figure out what was wrong with bedwetting with me and going into a teenhood and then adulthood. But yeah, get ready to hear my whole life and a lot of intimate details about my life, I guess. But yeah, so let's get started. I put my laptop down in front of me because I've written it on a Word document, so I'm gonna try not to look at the screen too much while I'm talking because it really bugs me if I do that, like I'm looking down while I'm talking kind of thing, so I'm also sorry for that in advance. The year was 1992 and little Olivia was born in October on the 20th in the afternoon. I was born and I was perfect and I was cute and I had little curly reddish hair. Apparently I had a perfect little round head is what my mom used to tell me. But anyways, fast forward 11 years, it is now 2004 and me and my mom are kind of just like, well, I'm still wetting the bed and I'm 11 and I feel like I kind of probably hit the mark where I should have not been wetting the bed anymore, right? So in May of 2004, my mom and I went to my primary doctor, which I'm very fortunate that I still have the same doctor. This is the doctor I've been going to since I was born. She's literally been there my entire life. So like, and I still see her. So I'm thankful that I still get to see the same primary doctor and that I live in the same area. So we go see my doctor and tell her that I'm wetting the bed still in May of 2004. Oh, just a little note. For you doctors and nurses and health practitioners out there, I'm gonna read word for word what all these medical notes that I have. I'm not asking for an explanation, I just think that it's worth explaining in the way the doctor did, and then I'm gonna try and explain it again in my own words because I was there and stuff. If you haven't watched my past one or two videos, I have been talking about doing this video for so long that it was becoming very daunting just because I got a whole CD of notes and there was 500 pages. Yeah, there was just not just my entire bedwetting history, but my entire history of like being in a doctor's appointments and stuff was all in this CD. In June of 2004, by the way, I am still 11 at this point. The doctor recommended that I get an ultrasound to see if my bladder was just an ultrasound or x-ray, diagnostic imaging essentially. So what they came back with was aorta is of normal caliber. No definite pancreatic pathology is identified. Liver is not enlarged. A focal liver mass was not demonstrated. No gallstones present. The kidneys are comparable in size, the right measuring 9.4 and the left 10.2 centimeters sagittally. No definite cyst, mass, or hydronephrosis seen in either kidney. The spleen, however, is enlarged, measuring 14 centimeters in a sagittal dimension with rounded contours and index of 34. Opinion of that was that I had mild splenomegaly, might have had a bit of an enlarged spleen. I guess they didn't really seem concerned about that. However, in November of 2004, I was referred to CHEO, which is the Children's Hospital in Eastern Ontario. I'm sure many of you have been there or been to CHEO or heard of CHEO. And at this point I am 12. So by the time I was 12, or April 2005, I ended up going to see a specialist at CHEO, and his name was Dr. Wolfish, or Dr. Norman Wolfish. At the time he was really old. And then I told my mom about this and she was like, yeah, he was really old then. And I was like, yeah, he just retired in 2010. And apparently his specialty was pediatric nephrologist. I've never heard of that before. He also was considered a bedwetting expert. So these are the notes he wrote. He wrote, Mom reports that Olivia was slow to train for days and was not dry until about 3.5 to 4. She had a fair amount of incontinence at that time. Presently, Olivia has mild frequency associated with urgency and some urgent incontinence. She is wet nightly, but may have the occasional dry night 1 in a month. She is noted to be a deep sleeper, which I still am a deep sleeper, and is difficult to arouse in the morning and does not arise until about 8:30 a.m. I wish I woke up at 8:30 now. Now I wake up at essentially 11 a.m. if I could sleep in until whenever I wanted. Like this morning I did that and I was like, ugh, I wanted to get my day started so much earlier. I fall asleep late and then I wake up late, and like I guess I've been doing that for my entire life. But anyways, it's just like she does not arise until 8:30. Like that's a big deal. Maybe as a 12-year-old that is, but I just like to sleep. She is known to wet somewhere in the middle of the night, and the mother feels that occasions she may void more than once. She has only the very, very occasional nocturia, which is, if you didn't know what nocturia is, it is a symptom of overactive bladder in which you wake up more than once per night to go to the washroom. Not wetting the bed, but waking up and physically going. However, she does awaken and void on her own during the night and will invariably be dry the next morning. There is a family history in that the parental grandmother was wet until about age 20 and the parental uncle wet until age 12. The father is a very sound sleeper. On the maternal side, there is no history of enuresis, but the mother is also a very sound sleeper. Or we just conk out or out for the night, I guess, our whole family. She had a trial of nasal DDAVP approximately 1 year ago and reported no significant change. She also had another course several months ago with no reported change. We outlined the causation of enuresis to both Olivia and her mom. Both seemed to appreciate the nature of the concern. We began on a fairly conservative approach with our behavior modification program and will reassess her in about 4 months' time. I ended up doing a DDAVP nasal spray, which is desmopressin, when I was about 11, I guess. And I remember that was the doctor. I think I've talked about him before. He ended up being kind of what I thought was a jerk because he only had boy stickers and not girl stickers. The majority of patients or children he was seeing were boys. So I was just irritated that he had to give me boy stickers, and he's like, well, mostly boys come and see me, so I'm just gonna give you these stickers for like when you wet or don't wet, and you put a sticker on the chart or something to encourage me, I guess, not to wet the bed. Anyways, he pissed me off. I was gonna say literally. So as well, that modification or behavioral modification program, I asked my mom about this and I was correct in that all I can glean out of that was the sort of like the bed pad, wake up in the middle of the night, sort of behavioral modification. And if you haven't seen the video with my mom in it, where she and I go through answering questions that you guys had, she explains that she just didn't want to wake me up in the middle of the night when I was younger because we were both miserable. I didn't want to get up. She just felt bad for waking me up constantly, and I just didn't want to. And you can choose to parent how you wish. Like, this is just like my mom's experience. She's like, it just was not good. I wasn't doing it. I was still wetting the bed, so she stopped doing it because this was her choice. She was like, I don't think that it's helping. She just stopped. And so the bed pad or the bed bell thing we never did, but this was our way of doing the behavior modification thing. I don't remember if we ever saw Dr. Wolfish again. I don't think we did because there's nothing else in these notes. So maybe she just didn't make another appointment because at this point she didn't know what to do. So she just wanted to see if I would just sort of grow out of it, kind of thing, which is a very conservative approach, as he kind of said, is that children should be taught to sort of grow out of it, but at the same time they're likely going to. So there's no one did anything wrong. I'm not blaming anyone. I'm just explaining that was my experience and my mom's experience when I was younger. So that brings me to November of 2011. So there's a big 6-year gap from where I did nothing. I was 12 till when I was 19. This was when I was going through high school, or going between homeschooling into high school, and I was still wetting the bed, and I was still having like problems throughout the day. So I took it into my own hands and I said, this is ridiculous. Something has to be done about this. So I made an appointment with my same primary doctor in November of 2011. And that's kind of where I consider my bedwetting doctor journey starting. Like when I was when I was just turned 19, I was just becoming like my own person, and I was like, I can't do this anymore. This is too much. I don't understand why it hasn't gone away. In the back of my mind, I always kind of remembered that my grandmother on my dad's side had wet the bed till she was 25. And I was like, I don't want to be 25 and still wetting the bed. And here I am at 26, still wetting the bed. Anyways, it just was time to see someone about it. And I was very embarrassed to do so, but I had to tell my doctor. I knew she knew, but I didn't know if she knew that I was still doing it. That's what I do. I go and see her, and she takes me very seriously and says that she wants to refer me to a urologist in Ottawa. And so I was like, all right, great. sounds like a plan. I kind of didn't know what to expect. I kind of remember being like, there's some urgency to this because she can't help me in the office. At the time, she also prescribed me desmopressin, or DDAVP, as I mentioned before. And this time it was a sublingular melt, which is the one I've consistently taken throughout the years, is the little melts that go under your tongue. So between waiting to go see Dr. Sean Pierre in Ottawa, I was given some medication to try. So that was kind of the only thing I got from her that day. As well, before meeting him, he had wanted me to go get an ultrasound done of my bladder. So that's what I did. I was referred to the Ottawa Carleton Hospital to go get an ultrasound done. So for this ultrasound, it was required of me to drink a lot of water beforehand, and then they would do an ultrasound on my bladder, and then I had to pee it out and do another ultrasound on my bladder. The thing was that they were telling me to do this an hour beforehand, so I started drinking on my way there and whatever, drinking a bunch of water. And I knew that wasn't going to be a great idea because I was going to have to pee before I even got into the procedure. So I'm drinking my water, I'm filling my bladder, everything's going great, and then I get there and I really have to pee. And I'm like, this is not good, they're not going to take me right away. So I go and check in and I'm like, gotta pee, man, like take me now. And I ended up having to pee, I believe. Like I peed a little bit, as much as I could, and then, or to hold on to before I could continue doing the appointment. And then the ultrasound lady said, there's not enough urine in your bladder, you actually need to drink more. So I was like, okay, that's what I'll do then. So she asked me to walk around the hospital, and I was like already wearing, like, I had my pants on, I think, but I was wearing like their gown, and I was just walking around the hospital drinking a cup of water, because apparently walking will help your body digest the water or whatever, make it go into your bladder faster, whatever, it doesn't matter. She's like, just walk around for 20 minutes, drink this water, and come back to me, and then we'll take the ultrasound. And I was like, great, sounds good. So I just remember walking around the hospital, just chilling, looking at all the people, walking by Tim Hortons, and just like watching people in line, just like sipping my water. Anyway, so I come back, and I'm like, okay, I don't know if my bladder's full now, but let's take a look. She does the ultrasound, and it's like, she's like, all right, it's full enough. Like, I'm like, it's not completely full because like the water is still digesting. So as she's doing the appointment and she's pushing the little thing into my bladder in my abdomen, it's like pushing into my bladder, and I'm just like, I really gotta pee now. And I literally tell her, I'm like, I am leaking. And she's like, yeah, just give me a couple more minutes or whatever. And like, so she's slipping onto my side and then doing it on the other side, like trying to get a whole image of my bladder. And I'm just like, I gotta pee. And so she lets me go pee, and then I come back, and then she does more ultrasound on my bladder. And so she finishes the ultrasound, and then I go home and stuff. I don't really remember what she said during that appointment, but these are the notes that they documented. So she wrote, the liver, the biliary tree, the gallbladder, pancreas, and spleen are normal. So my spleen is back to normal 6 years later. So I didn't have an enlarged spleen. Kidneys are of equal size, but poor cortical medullary differentiation, suggesting possible underlying medical renal disease. No evidence of renal stone or hydronephrosis. Aorta is within normal limits. The urinary bladder has smooth contour and clear lumen. Uterus is antverted. No abdominal adnexal mass demonstrated. These words are big. And there is no free fluid. A small amount of post void residual urine, estimated 20 centimeters. So the conclusion is that the small amount of post void urine documented, so after I peed, possibility of medical renal disease to be correlated with clinical picture. I didn't get to see the picture in the notes, but I don't know if it was actually attached. I don't know. All I'm saying is that they saw something that wasn't really too remarkable, but they wrote it down anyway just in case. I don't think there was anything that ever went of that renal disease. I was never told anything else because it just didn't seem too remarkable. I met with my doctor, Sean Pierre, and he decides that we should do a bladder scan, a hysteroscopy, and that is what I talked about in my last video, if you want to watch that. I'm not going to go into too much detail with it because of my last video is basically about how they met these 3 appointments that I had. Not in consecutive order, but 3 appointments that I had done to do exams of my bladder size and capacity and filling. So in July of 2012, I'm at my doctor's clinic in Ottawa. So this is Dr. Sean Pierre, and he wants to do the bladder exam with the camera. So I'm apparently lying down in what's called a modified supine position. I just thought it was basically what it feels like when you're having a pap smear exam done, where everything is just kind of like exposed. and I was just basically lying down flat. So there's a lady and she goes and cleans everything down there, and I'm very uncomfortable and vulnerable, but it's eventually everything's covered up again. So then the doctor has to take a camera and put it into my bladder. That was like not too uncomfortable. Remember, obviously they used a numbing gel, I think it was xylocaine they wrote. And in my previous video, you'll remember that there was no findings, nothing remarkable in this procedure. So then he asked me to book my urodynamics study for September to see if there's any filling problems or voiding problems. He also asked me to try Detrol LA in the interim before I see him again in October. So this is another drug now that I'm trying. So my doctor, Dr. Sean Pierre, has a tendency to write extremely long, very detailed notes, and I remember him telling me this when I meet him, like most of the times, like every time he'd be like, I leave really in-depth notes so that every doctor knows exactly what I've done and checked and all that. And now I understand. He's like, sometimes doctors don't like it. I was like, all right, whatever. He's like to be very thorough. And so now that I've seen all the notes, like they're like pages long. Like I think one of them's like, as they get longer, because like as the more I see him, each time they get more added to it. And like some of them are like 5 pages long, just of like written, like typed out notes. I'd have to skim through them as I'm reading through all my stuff and figure out what was useful and not useful. So I just want to read at least one of them out to you because it's like one of the first times that I've met him. So the patient is a 20-year-old Caucasian female who was referred to me with a history of nocturnal enuresis. She has tried DDAVP in the past. She also has a long history of voiding dysfunction. She has irritative lower urinary tract symptoms with occasional urge urinary incontinence, so overactive bladder. She averages 1 cup of coffee per day. She denied any constipation. Her nocturnal enuresis was a bit better before the age of 10, but then worsened until her mid-teens, then improved somewhat, then worsened again. The inpatient's nocturnal enuresis is not usually as severe when she is sleeping at her home as opposed to when she's sleeping at other people's homes. He got that reversed. It's actually worse when I'm at home versus when I'm at other people's houses. The patient had no pelvic surgery at all. The patient is a lifelong non-smoker. Laboratory investigations done in January 2012 showed a normal serum creatine, normal serum glucose, and normal CBC. A urine culture from 2012 was negative. An ultrasound of the abdomen and pelvis done in January 2012 showed a post-void residual urine of 20 milliliters. It was very difficult for the patient to fill her bladder. There was a suggestion of possibly poor corticomdulary differentiation in the kidneys, but as said before, the patient's creatine was normal. The overactive bladder symptom score was 39 out of 40. I started the patient on Vesicare 5 milligrams. Unfortunately, she said that she felt unwell for 2 weeks after starting the medication and probably only stayed on it for approximately 4 weeks. She did not see any significant improvement in her symptoms. I do not think she got any of the dry mouth, which is a bit surprising. After discussing the various further investigational and management options available, the patient elected to proceed with endoscopic evaluation of her lower urinary tract. Oh, a lot of words there. Okay, so I actually don't really remember even trying Vesicare. I do remember going through quite a few medications in a year and a half, and this is about this time frame. And he obviously gave me a chance of trying Vesicare, and obviously it didn't make me feel great. So I don't really remember that at all. I'm imagining it's true. I can't, like, obviously it is, so I just don't remember my experience on Vesicare at all. So I can't really tell you anything about that other than the fact that apparently it didn't make me feel very great. So in September 6, 2012, this is where I see Dr. Ronald Jerryson, or Dr. Jerry, at the Ottawa Hospital on Carling for my pressure flow urodynamics procedure. So that is the one where, like I said in the last video, where they fill my bladder and then they empty it to see what kind of fluctuations and whatever, blah, blah, blah. Earlier I said 20 years old. I meant to say 19. I got my own age mixed up. Sorry about that. So I'm going to see Dr. Jerry for my urodynamics procedure, exam, whatever, and I'm still 19. So this is the referral from Dr. Pierre from the previous procedure for one in July or whatever it was. As well, I talked about this in my previous video, so I'll try and skim over this. But to recap, I was in a room with a lady who sat me down and had a bunch of tubes in my urethra. So she filled my bladder in the sitting position, then asked me how full it felt, and then asked me to void when it got really full. When she filled it, she only got to 228 cc's of water, and then when I voided, I only voided out 134 cc's of water, leaving a difference of 94 cc's of water. In the end, I had what they call dysfunctional voiding. As before, when they started procedure, I had a post-void residual volume of 50 cc's. So that tends to be a recurring theme with me, is that I leave a little bit, actually more than a little bit, in my bladder when I'm urinating. I've now, like I've said this before, I've started to try and sit on the toilet longer so that I get more out, so that my bladder can fill more and is not as irritative. So that's actually been helping a lot. But yeah, overall I had some pretty high pressure in my bladder. She said it spiked to 75 centimeters full of pressure in my bladder at one point, and then spiked very high for a long time. Until it came down to about 44 centimeters of pressure. So it is now October 1st, 2012. I am still 19 as of this point. I'm at Dr. Pierre's for a follow-up and consult on these exams. So I tell him my response to the Detrol LA, or Tolterodine, was mild, and I was still having significant nocturia and bedwetting, so he decides to try me on Ditropan, which is oxybutynin, 5 milligrams by mouth, twice a day. He said to watch out for side effects including dry mouth and constipation, and then he said he'd follow up with me within 3 to 4 months. The reason he prescribed this medication, which it relaxes the muscles in the bladder to help decrease problems of urgency and frequency in urination. Oxybutynin is in a class of drugs called antispasmodics. So he prescribed this particular drug because I empty my bladder well, and he believes that a trial of anticholinergics would be good for me, and that it would help me with some of my symptomology. Oral anticholinergics would likely help with daytime symptoms more than nighttime symptoms, but is a good place to start, he said. He also recommended for me pelvic floor physiotherapy, which he said was not covered by healthcare, and I don't believe it still is. So unfortunately, I knew it was going to be pretty expensive, and I don't actually end up doing this until about 2015, so I'm not going to talk about pelvic floor physiotherapy in this video, because that'll be for next time. And then he also recommended DDAVP again. So he did mention that I did tell him that DDAVP had helped me with nocturia or nighttime bedwetting before, but not with daytime symptoms. So he also writes that she tends to be a bit variable in how she describes the severity of her daytime symptoms, which is true. They vary drastically for me. Like some days they'll be really, really great, and some days they're just terrible. So it's now January 28th, 2013. I am now 20 years old, finally. Get my own age right. So I'm back in Dr. Pierre's office for a follow-up and consult with the Ditropan. So apparently the Ditropan tablets did not go over well. So he comments in his notes, the patient had a very poor experience with the Ditropan. She was dizzy and had some GI upset. She tried decreasing the medication to 1 tablet by mouth daily, but still had symptoms. She eventually stopped the medication. Of note, the patient has had a history of low back pain, for which she has seen a physiotherapist in the past. So let me go back a little bit. I find that the biggest symptom for me with medication is feeling dizzy. Once I read that, I was like, oh yeah, I do remember feeling incredibly dizzy when I tried this medication. And it's kind of interesting, like once you get to know yourself and how you react to certain things, like didn't know that was a thing until as I take more medications, I'm like, I'm dizzy. Like I always find that is like my biggest thing with medication. And I never really found that I got dry mouth with any of these things, so he always thought that was a little bit surprising. I'm like, I don't remember feeling like I had dry mouth. I think I would know, unless I always have dry mouth, which I don't think I do. But anyways, I find that I'm dizzy, like super, super dizzy over certain things, and then dry mouth is just not a thing that I experience. So I just think that's interesting. Let me know in the comments if you've tried any of these medications before, what your experiences with them were, or side effects with them were. If it wasn't dry mouth, if it was dizziness or whatever. I'm just interested to hear what you have experienced with these medications. So at this point, he now wants me to try Gelneek, which is still oxybutynin. However, in the name, as you can see here, it is a gel. So it is not a tablet, it is not anything else. You have to actually put it on your skin. He would also like me to do blood work, and then he has actually asked me to get an MRI done of my spine. He also sends a referral for me for physiotherapy for back pain as well. So I ended up doing blood work the same day. I actually went downstairs, was a blood work, Life Labs or something down there, and I had the blood work done so that I could just get it over with. The reason that is important is because Dr. Pierre was the only doctor that was consistently worried about my weight. He always brought it up. He was always saying that I'm overweight. And at this point, I'm still like gaining weight. And he was worried that I would become diabetic. And I had a feeling that essentially he wanted to prove that I was or wasn't diabetic so he could treat the symptomology properly. which makes sense, but I was like, I am not diabetic. I've had lots and lots of blood work done before. I'm not diabetic. I've never had a diabetic symptom in my life. So it was just frustrating. Like, I do and don't remember this. Like, it wasn't really like super irritating to me. I was actually kind of proud of the fact that I wasn't diabetic. I'm actually still kind of proud of the fact that I'm not diabetic. Currently, I am working on eating better and losing weight, and I actually have lost a bit of weight. And I want to not get to the point where I'm diabetic, but at this time, he was constantly trying to blame it on being diabetic. I'm like, I am not diabetic. Stop it. Like, stop this nonsense. So he wanted me to get blood work to see if I was diabetic. And I was like, all right, fine, I'll go with it. He was actually somewhat impressed that I wasn't diabetic, which is really rude. He was just like, I feel like that's what it is. I'm like, dude, it's not. Like, I promise you. Like, considering all my problems and my weight and like the bladder problems and stuff, like, it would make sense that I would be, but I'm not. Nothing in my life makes sense when it comes to medically speaking. So I just thought it was very confusing because I had never personally experienced any diabetic symptoms. I didn't really know what diabetes was, to be completely honest. And because I was healthy, and I am healthy, and there was nothing else in my life that was like chronic illness or pain or anything, that I was just confused, but happy, but confused that he was trying to like find something else to blame it on, which is what a doctor should do. It was just that it was every single appointment, even after the blood work was done. He was always just surprised that I wasn't diabetic. Because I personally, like I said, I didn't understand the correlation. I did know that my weight was starting to climb. I just didn't understand the correlation between being diabetic and having urinary problems. But he constantly and consistently reminded me that having extra weight, especially on the belly region, would have an impact on my spine and my bladder, because having extra weight would be pushing on my bladder, so that could cause me to be overactive or something like that. In the meantime, I consistently told him that I was never this overweight, and the fact that my bladder is still overactive and I'm having bedwetting issues can't be blamed on my weight, just because of the fact that I was, like I said, quite light or whatever. I was not overweight. I was actually my BMI when I was in high school was 25, and I'm 5'9". So I was just at the average or healthy weight when I was in high school and still wetting the bed every night. Like, when he's meeting me here, I believe my BMI was 35 or 40. So it's gotten worse, but at the same time, he's blaming it on the BMI and my weight versus what is actually, we're not sure why I have overactive bladder. I'm going on a rant. I'm just explaining that it was just a little bit frustrating. Also, one more thing before I leave this topic. I want to point out that Dr. Pierre is like a 5'5", tiny African-American man. Like, he is a little person. Like, he was so skinny, so tiny, just little. And like, he probably was like 110 pounds soaking wet. Like, he was so small. And he must know that telling someone who's me or anyone, even like a full-grown man, that they need to lose weight, it just doesn't come across very well. And then his approach was, he was very nice. He's a very nice guy. He was really doing his job. It was just that coming from him, he didn't really provide solutions. He just sort of told me that it could be a problem. And anyways, here we are. So here I am thinking that he wants me to see that I have diabetes. Meanwhile, I'm positive and confident that I didn't and don't, and I still don't, and there's nothing wrong with my glycemic or blood sugar levels. But the blood work he requisitioned showed that my glycemic level was normal in a non-diabetic patient. Thank you very much. Anyways, as for Gelneek, if you haven't tried it before, like I said, it is a gel. I used to have boxes and boxes because he likes to give me samples, which was really nice because I was really poor and I couldn't afford it and I didn't have health coverage as I do now. But, or drug plan, because in Canada you have health coverage, but there's certain things you have to pay for, which is drugs usually, and certain physiotherapies and stuff like that. So he would give me samples, and he gave me I think 6 boxes, and then inside was 10 or 20 boxes or containers of these Gelneek things, and he would just load them onto me, which like I said, I really appreciated. They'd be these little black containers, and he'd flip it open. It kind of looked like a compact, and inside would be 5 or 6 Gelneek packages, and you'd rip open a sachet, and then you'd squeeze it onto certain parts. So you could put it on your shoulders, the backs of your shoulders, your the left or right side of your lower abdomen and on your back. So there's like 8 places you could put it, or maybe there's more now, I'm not sure, but that's what he recommended to do. And I couldn't consistently put it in the same spot every single night or day or whatever. I had to separate, put it on certain places. So that was just the thing with Gelnique. And it obviously wasn't very significant in treating my symptoms because it just didn't do anything. I just felt kind of gross. I want to touch on one more thing, and I think I'm going to end this video because it's going to be quite long. This part was the MRI. I just wanted to finish up the basically that appointment, if you will. So it's still 2013. I'm not going to be able to get to 2014 in this video. So March 2013, I had to go to Queens by Carleton Hospital for my MRI of my spine. So the goal of the MRI was to rule out spinal pathology. The vertebral bodies of the lumbar spine are normal in height, signal, and alignment. The conus has normal shape, and signal lies at the level of L1. Adequate disc space, height, and hydration of the lumbar spine. Overall, no significant abnormality identified to explain the patient's symptoms. Woot! For this procedure, I ended up going alone, and it was one of the saddest times. I remember feeling incredibly sad, disappointed, frustrated, and just very depressed. I remember starting to feel a bit unusual, like there was something wrong with me that they couldn't figure out why I was still wetting the bed. I didn't really want there to be anything wrong with my spine. I didn't think that there was yet. I will get into some spinal problems later, but like I felt very alone, sad, and scared, and it was just so depressing. I really just wanted a medication to work at this point, because I was like, that's what medications are for. Why are none of them working? And it was just so sad, and it really kind of hurts me to remember this. Like one of the few appointments that were really depressing and sad. This was one of them, and I would think it was like the first one where I was trying to realize that something's wrong. Like I was angry. I was starting to get really angry about it. Speaking of anger, at this time in my life, I'm starting to really deal with my actual anger issues and depression. At this point, I'm in the middle of dealing with depression and seeing my first therapist for the first time, which I saw all those notes and stuff from those doctor's appointments and referrals in my CD of his health history. So those were fun to read. So I didn't know how to deal with my anger, and people around me were always irritated and angry because I was always irritated and angry, and I didn't know how to deal with it. So I had gone to see my doctor for anger issues and telling her that I don't know what I'm doing. I'm just always angry, and I didn't really think I was depressed, but I knew I was angry. So she referred me to the CBT therapist in the office, and fortunately she was covered through the healthcare in the office, so I got to see her a bunch of times. I think I saw her for quite like 2 or 3 years, non-consistently for some of them, but and she was great, and but it took me a long time to get used to her and to understand and fully wrap my head around what those thoughts and feelings were, especially more or less like my thoughts. Like I thought that everything had to be black and white. I just had all these thoughts that didn't really make any sense, and it took me a long time to like figure out that I didn't have to lash out at people, and I could love people, and I didn't have to always be angry and stuff like that. So yeah, at this point I'm at a doctor's office, or I'm at doing this MRI, and I'm like feeling all these anger issues and problems. So I was just sitting in the waiting room in my little robes, and I just felt like crying, and it was just very depressing. So I'm going to end this video here. I'm going to try, I don't think I'm going to be able to finish this in 2 episodes. Actually, you know what? I'm going to finish, okay. I'm going to go through one more doctor's appointment, and then I'm going to leave you on a cliffhanger. Okay, so in July of 2013, just after seeing my MRI, or having that MRI, I go back and see Dr. Pierre again. So he mentions in his notes that I did go to see a physiotherapist, which I do not really remember, but obviously I did see someone, and he writes that I did have some mild improvement in my daytime symptoms. I don't know if that's entirely true, but that's what he wrote, so I imagine that I did. Sometimes I would write stuff that just sounded good. Like in all of these notes, he wrote that I wet at least 5 out of 7 days a week. Meanwhile, that's an average. Meanwhile, it should have been more like 7 out of 7 days a week. But anyways, he mentions that my glucose levels were normal. 5.3 was my glucose levels, or sugar levels, in January 2013, and they were 5.4 in January 2012. So thank you, body, for having normal glucose levels. from the blood work, so that's good. And he knows that the MRI done was also not significant. He's now deciding to prescribe me something new, and so he brings up a new and exciting drug called Myrbetriq, which at the time was brand new to a lot of the urologists in Ottawa, I guess, or whatever. So something a lot of urologists were prescribing. He was really excited about it, and he was really excited for me to try it. This is a medication that they prescribe to patients who had very little success with other medications in other classes and categories. So he was like, yes, let's try this, let's get you on this drug, it'll be good. Like, that was his recommendation. So he actually gave me some trials of 25 milligrams to take by mouth daily. And he also suggested that I try oxetrol, which could be potentially combined with Myrbetriq to optimize my results for relief of symptoms. He said that I would need to call back after trying Myrbetriq for like a month or something, and then he would prescribe oxetrol if he felt the need to. So that was the follow-up after the MRI and the blood work and the physiotherapy appointment. So things were going like okay, like they weren't like great, and I wasn't having any help from anything. So I'm here gonna try Myrbetriq, things are looking good. And then I end up breaking my back twice. And I will discuss that in my next video. So I don't really know if this is gonna be a 2-parter or a 3-parter, but I'm gonna try and make it 2. This video is gonna be a little bit long because like I need to tell you about everything that's happening. So at this point, we're stopping halfway through 2013, or partway, yeah, exactly halfway through. We're in July. So I will see you guys in my next video, and I will talk about, bring back up from where I broke my back twice in a matter of 3 weeks, and I'll go into all the details about that. Anyways, that's all. So I hope you enjoyed this video. I hope you learned some stuff about me and learned some stuff that you might be able to try. But yeah. I've been through a lot. This is just part of my experience, and then the last 5 years or so, 6 years, there's a lot of really intense information in there. So I'm excited to film it. I'm actually on vacation this week from work, but tomorrow I am going to go visit my best friend Ashley in Mississauga, so I'll be spending the rest of the week and weekend with her. It's her birthday weekend. So I won't be filming this week probably until maybe next weekend. I don't know. I'm not gonna promise anything because I never end up doing the things that I want to do. So anyways, I hope you enjoyed this video. Please share, like, and comment if you found that it was useful in any way, and I look forward to seeing you guys again. Bye! Splenomegaly, splenomegaly, so the opinion, why can't I say that in my head? I can say splenomegaly, 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 splenomegaly.